Again, just welcome everybody. We will get started. We have plenty to share with you today. So as folks are joining, please do put your name in the chat. Let us know who you are, where you're from, what you're funded under, if you know, if that's something that's easy for you to pull up. And we will jump in. So welcome to the first of our 5-day SPIF Strategic Prevention Framework Blitz. We're going to be going through all of this framework in a really quick way between now and Friday, so you can get a little dose of all of it, should you choose to register for each one. Today, you are here for the Assessment in Action webinar addressing youth vaping through the Strategic Prevention Framework. My name is Katie Chikoyan. In a minute, I'm going to introduce you to Nicole Shamborn, and we are excited to be with you this morning. Before we get started, just a brief acknowledgement that this material has been prepared by the South-Southwest Prevention Technology Transfer Center out of the University of Oklahoma under a cooperative agreement from SAMHSA, the Substance Abuse Mental Health Services Administration's Center for Substance Abuse Prevention. Please do not reproduce or distribute this publication for a fee without specific written authorization from the University of Oklahoma. And also, the opinions that are expressed here are the views of the authors and don't officially represent the Department of Health and Human Services or SAMHSA. In our time here today, over the lunch hour for many of us, we are hoping that you all will leave here with the ability to define the role of assessment within the strategic prevention framework, identify key data sources and methods for assessing community needs, and apply the assessment process to a case study to illustrate how data can inform decision-making and guide prevention strategies. To do all of that, we're going to start with our introductions, which you are all doing right now. I'm so glad to see so many comments in the chat. If you're just coming in, we were asking folks to drop in your name, where you are calling in from, and if you know what grants you're funded under, that would be really helpful to us. We're going to do a quick overview of both Strategic Prevention Framework and of logic models. Those are two tools that will be with you all week should you continue through our series this week. And then we're going to spend some time really honing in on assessing and selecting the problem, and then assessing and selecting risk and protective factors. We will make sure that we have some time for questions at the end. And then, of course, we do have an evaluation because we always want to hear your feedback on this process to help us continue to deliver programs and webinars that are helpful to you in your work. So without further ado, I will first tell you just a little bit about myself. As I said, I'm Katie Chikoyan. I am the epidemiologist for the South-Southwest PTTC. I provide training and technical assistance to support our regional clients to employ epidemiological data in your assessment and implementation of prevention efforts. I have over 15 years of experience on the ground and also through research and evaluation working to address social public health issues, as well as some extensive project management experience, specifically conducting needs assessments, developing logic models, and facilitating programmatic strategic planning processes. I am a PhD candidate currently at Brandeis University studying social policy. And then with me today, and who's going to be really leading us through the bulk of our time this morning, or this noon hour, my brain hasn't shifted quite yet, is Nicole Shamborn. Nicole brings 25 years of public health research and evaluation experience to the South-Southwest Prevention Center. Sorry. We've got too many acronyms in our titles. Nicole currently oversees all evaluation reporting and analysis for several grants out of the Southwest Prevention Center, including the South-Southwest PTTC. She plays a vital role in providing high-impact evaluation, training, and technical assistance services to the prevention workforce, emerging prevention professionals, organizations, and community prevention stakeholders, including designing effective logic model and evaluation plans. Nicole is an internationally certified prevention specialist and an adverse childhood experiences interface certified instructor. She received her master's degree in experimental psychology from the University of Central Oklahoma. I'm not turning it over to her just yet, soon, but Nicole, do you just want to give a little wave and say hello?
Hi, everybody. So glad to see you all here today. And we have a lot of folks here. So glad to be here to talk about assessment today. And we'll talk soon.
Thank you. So before we jump into the assessment, just want to kind of ground us in the strategic prevention framework to start off with. So as I said, this is the first in the series of 5 this week that will be, and we will be covering the very first step of the strategic prevention framework, which is assessment. Assessment helps us understand substance use and related problems in a community, as well as how to determine the resources and the readiness of the community to address these problems. And I would love, before we even get started with anything, if you would either raise your Zoom hand by clicking that reactions button or your actual physical hand. But how many of you are familiar with this BIF before coming here today? Okay. Getting some Zoom hands. They're coming in faster, more fast and furious. Thank you. And a couple of on-camera hands, which I appreciate, but certainly not everybody. And so that makes a lot of sense to me. We've got folks who maybe have used this for a long time, maybe some who are still getting comfortable with it, and some for whom this is really an introduction. That makes sense. So the key steps in the SPIF are these sort of 5 big buckets of steps that contribute to the framework. So the first is assessment, then we go to capacity, planning, implementation, and evaluation for preventative strategies. The SPIF really emphasizes using a data-driven approach, using local data and evidence-based practices to ensure that the prevention efforts are really effective, that we're making decisions that are based on what's going on in our community and that we're having impact in our community. Therefore, community engagement is another one of those really key components throughout the SPIF. The framework promotes engaging stakeholders and tailoring interventions to the cultural and community needs. And then finally, there's a real focus on sustainability within the SPIF. So the SPIF encourages building community capacities to sustain prevention efforts over time. And I would love to hear just your thoughts in the chat, or if anyone wants to come off mute, we have a second. But which SPIF step do you think is the most challenging to implement and why? Just give folks 1 second to see what comes up to the top on that. Between assessment, capacity, planning, implementation, and evaluation. Evaluation, capacity, evaluation, implementation, capacity, evaluation. So I am hearing, actually, what I'm not hearing a ton of is planning, which is really interesting. Less implementation, more capacity, more evaluation. Great. And actually, I don't think anybody has said assessment yet. So you all are experts and know everything we're going to say today, which is perfect. And I do hope, yeah, thank you. Someone just wrote in the chat, no.
I do see one assessment, Katie. One
Okay,
assessment.
good. I clearly blinked when that one came. Um, well, I think that we'll be able to share some tips and trips this today that will be helpful for everybody. And I do hope that, thank you, Christy, for putting assessment right there in front of me. I hope that you all will join us for some of the workshops later this week too. All right, I think I have just one more thing to share with you. So here's an example of the SPIF in action. It's really a fancy name for something that we do every single day in our lives, the strategic planning process. And I think strategic planning even is a fancy name for something we do every day in our lives, right? So here's an example, just a real life scenario. A couple of years ago, I decided to plant an herb garden. So I had to go through this process of what am I going to do, right? So I'm starting with an assessment. What kind of a garden? Will it be a raised bed garden, a border garden, I ended up deciding to do a circle garden. Where is it going to be? Where's the southern exposure? Where in my yard is going to get the best conditions for this garden? Decided to plant it by the barn. And then what's the condition of my soil? Is by the barn? Great, that's great soil. Then when am I going to do it? Early spring. All of those questions, that is my assessment process, right? Trying to figure out what's going on here that I have the ability to work with, what's going to make me most successful. Then I need to think about my capacity. So what resources did I have already? Good soil, we talked about. We've got my garden fork, a drip hose, maybe an herb book, and what my budget is, $100 for this garden. And then where are the gaps in resources? So I'm going to need to rent a sod cutter. I'm going to need to buy some drip hose connectors to just, again, identifying what I have and what I need. That's the capacity piece. Then we go into planning. So I'm going to go out and buy those hose connectors. I'm going to rent the sod cutter. I'm going to remove the sod. I'm going to fork the soil. I'm going to buy the perennials. I'm going to buy the annuals, right? I'm doing all of the process that needs to be done so that I'm ready to plant that garden. That's the planning piece. Step 4, implementation, you do it, right? I'm actually going to plant. I'm going to hook up the drip hose. I'm going to get it all going. And then step 5, evaluation. So in the short term, I'm in the process of doing this, and guess what I forgot? I forgot to get a deer fence. Now my parsley and my cilantro are all gone, right? And I need to think back, okay, if I'm going to do this again, or even if I'm going to course correct now, what do I need to do? I need to get that deer fence and put it out on the garden. In the long term, next year, I'm going to maybe transplant those perennials around the edge because the deer don't eat those, and then put the annuals in the center, right? And so I'm just taking this kind of critical look. How did it go? What were the trouble pieces? How am I going to adapt what I'm doing so that I can have a better outcome next time I run this program? So all of that is to say, strategic planning can sound overwhelming. Using something like the SPIF framework can feel like a very technical thing, but this is really intuitive to the way that we think and operate in the world. We're just trying to apply it in our work here. All right. I'm going to go to the next slide, but then I'm going to ask you a question about this slide before we talk about it. So Richard, will you launch that poll, please? Thank you. And so this is just a quick little poll, but off the top of your head, which of the following are the steps of the SPIF? Good job. I'm seeing lots of answers coming in. Great. Nobody is okay, all right. I'll show you all, but nobody chose one of the answers until just now. You're doing great. We've got about 3/4 of people responding. We'll stop the poll in just a second. All right. I know we still have answers coming in, and I think we can get the gist of it here. So I'm going to end the poll and share my results and show you that the steps of the SPIF, of course, are assessment, capacity, planning, implementation, and evaluation. No, they're tricking you up by putting them in a different order in there. Nice job. All right, last thing I have to share, and then I promise I'm going to let Nicole take over. But I want to talk about logic models. So if the process is the SPIF, right? But the plan to get there, the roadmap to get through it is the logic model. It can show us what our issues are, what's contributing to them, and what we're going to do about it. In the past, when we were looking at problems that are faced by communities, we would typically go straight to finding solutions and selecting those interventions. And after all, it is a lot more fun to do programs than it is to necessarily do planning, right? I think that's maybe what was reflected in all of your responses before. And also, most of our coalitions are really focused on action items. We see a really important problem and we want to try to fix it right away. That makes a lot of sense. And without that good, solid planning, it's more of an approach of kind of throwing programs at problems. That's the terminology we would use for it. and it doesn't lead to great outcomes, right? Because we're not necessarily matching our interventions to what's really going on in the community. Instead, the SPIF process recommends that we use data to learn about the problem in the community, then look at the factors that influence and contribute to that problem, and then, based on that information, select the best possible intervention to address those factors that are contributing to the problems in that specific community. So there is some logic behind this logic model. And as a result, we see much better outcomes when we get to sort of trying to do that evaluation process. Um, Last note is that the technology can, I mean, excuse me, the terminology can be a little bit complex. So sometimes you might hear problems and related behaviors. Other times you might hear consequences and consumption. Risk and protective factors might sometimes be called intervening variables or causal factors. Interventions can be referred to as strategies. There's all this different language, but whatever terminology we're using, we're basically trying to say what's the issue we're trying to solve, what's contributing to it, and then how do we select the intervention that we're using. Okay, with all of that, Nicole, let me pass it over to you.
Sure. Thanks, Katie. Apologize for my voice. I'm a little hoarse this morning, but it'll come. It'll come. So I love that example and that Katie talked about with looking at how you're going to plant a garden and approaching getting that fence for the deer. And in my case, it's not deer, it's a possum that attacks the garden. So you always have unexpected things, which we'll talk about later in this series, or sometimes we have to adapt, right? So here is our assessment step, and we call that the first step of the SPIF, which I often like to talk about. While it might be the first step, it doesn't mean that some of these can't be happening at the same time. So that's something to remember about the SPIF as well, that it can be very cyclical and we can, and I think someone might need to mute Christina. Thank you. So we just want to make sure that we've got the purpose of our assessment. We want to identify the community needs, resources, and readiness to address substance use effectively in this step. We want to look at the components, and these are going to include our risk and protective factors and evaluating those resources and prioritizing issues by impact in assessment. And then we also are going to be looking at how engaged is our community. So we want to make sure we're engaging our partners in data interpretation, and that will really help us get that buy-in and that collaborative decision making that we're seeking in this step. And it sounds strange to say, why are we talking about community engagement and assessment? But as you'll see throughout all these steps, really making sure your community is engaged is extremely important to make sure this process is effective. So now let's talk about our basics of assessment and what we're going to assess. So we look at first that big step at the top. We want to look at the nature and extent of substance use and related behavioral health problems. So this is where we look at who's using what, when is it happening, where is it happening, and what are the consequences of the use. We also look at the risk and protective factors that are influencing or contributing to these issues in our particular communities, and then the existing resources and readiness. So just kind of making sure we cover all of our bases here in assessment, because if we don't, it's really going to affect the rest of the steps of the SPIF, and we won't get the results that we want. So all of this leads us to finding out what's contributing to our problems, what we're seeing in our communities, and also addressing the underlying risk and protective factors with those interventions that are going to work. So this is all a lot better than, like Katie said, we don't want to throw programs at problems and hope they stick. And sometimes we really have to safeguard ourselves as preventionists against jumping to implementation, right? We want to get to the doing. We want to get out there and start working in the community, but we really have to take that the planning seriously, and assessment is super important to make sure what we're doing is going to work. All right, so now let's talk about some examples of substance use related issues. And this is just really to help you see that things go much more beyond just the substance use itself, right? What is happening in addition to someone using, or let's say we're going to use an example today of vaping. So if someone's vaping, what are the other things that can happen? We might see that there's some disciplinary things that happen at school related to vaping, which can affect education. We might see some health effects. We might see some money issues, even. Smoking, vaping can get expensive, especially for youth. And so that can be a consequence of that behavior. Lung disease, lung cancer, all of those things we know. And so it's important to think beyond just the substance use issue itself and what are the other consequences that are happening in our community. So let's talk about what you think might be a substance use related problem that is occurring due to youth vaping in your community. And you can post that in the chat over there that Richard's highlighted. So what substance use related problems do you see in your community for youth vaping? Jessica says lack of parental monitoring, environmental, nicotine addiction, brain development issues. Yes. Vaping in the bathroom is making it uncomfortable for people. Lower motivation, missing school and learning. You guys are doing fantastic. Vaping laced with another substance can lead to overdose. Great point. Alternative school programming, cannabis use. Yes, very good. Anxiety and panic attacks. Yes, stress, interference with learning. Boy, you guys did great. This is a great list, Katie. Uh, we might need to update our chart with some of these. That's fantastic. Well, I was going to go through all of those, but you all have covered all of them. Another one that we might see is withdrawal symptoms, right? And the things that can come with that. So nice job on that. All right, so let's now talk about some examples of substance use behaviors. And so these are some examples that we might see referring to consumption. And that's, we're consuming this particular drug, that sort of thing is all consumption means. We also can have acute or heavy consumption. For example, there might be a particular age when a certain substance spikes up. How does lifetime use or 30-day use and binge use compare? And then we also can look at consumption in risky situations. So is there, in the case of drinking, is there drinking and driving? When we look at smoking, is smoking occurring around young children? And then we get into looking at consumption by specific groups, and we will talk about that today. We're going to talk about youth vaping. So what does substance use look like by certain age groups and other demographic groups or certain circumstances, for example, pregnant women. So in the chat now, can you think of other examples of substance use behaviors or consumption patterns you'd want to assess? Or things that you have assessed in your community. And this could be you've looked at substance use by particular groups in your communities. You've looked at special circumstances. Okay, so Kenya says anger issues. Great. Seniors. Very good. We are looking at youth, outlet density study, youth tending to go into isolation. Great. The effects of advertising, parental engagement, misinformation about medicinal use, locations. Great. Housing insecurity. You guys are hitting a lot. Fantastic job with that. All right, so now I'm going to pass it back over to Katie, but you'll see me again. So,
So when we talk about assessment, we need to understand what epidemiology is at a very high level and how that informs what we're talking about when we talk about assessment. So epidemiology is the study of how an illness or a condition, in this case, substance use, or more specifically, this youth vaping, how it shows up in a community, how people get it, and what they can do to protect themselves. So we're focused on these two buckets. One is distribution, where is it, or what's happening. The other is determinants. Okay? To illustrate epidemiology, let's sort of take a step away from vaping and think about the flu, a little more traditional epidemiology. First, we're going to look at distribution. So my first question for you, and we're going to go through these pretty quickly in the chat, so spit your answers in just like you have been. First question about distribution. Who gets the flu? Go ahead and put that in the chat. Everyone, anyone, everyone. Great. People who are exposed to the flu. So many anyone's, everyone's. Great. We've got some public health practitioners here. Okay. Next question. When do people get the flu? Immunocompromised. Thank you. That's important. When they're exposed, flu season, winter, anytime when they're exposed, when they're exposed, when they're exposed, all year long, flu season. Yeah. Okay. So yes, you can get the flu any time of year, right? It's about that exposure. And flu season happens at a particular time of the year, right? So we're not even yet thinking about like, why does it happen then? We're just knowing sometime in this like November to February time, we're going to see a lot of spikes, right? We might also, going back to who gets the flu, we might be seeing teachers, people who have a 2-year-old at home, which is myself, right? We're seeing kids, right? So there are some patterns here that we're looking at, and that's helping us think about distribution so that we can get to some of those why questions, but really understanding what's happening more frequently. Last question on distribution. Where do they pick it up? Where do you pick up the flu? Staff around children, anywhere, social networks, infected people, public spaces, where you are, daycare, schools, hospitals, from other people who have it, kids, loved ones, the public. Perfect. Great. So we're starting to identify what are some of those kind of problem areas where we need to be paying attention to. Then we want to think about determinants. So this is sort of what's changing the likelihood of somebody actually getting the flu. So first question here, what kinds of things might increase the chances that a person will get the flu? Or what are the risk factors for contracting the flu? Not washing your hands. Low immune systems. We talked about immunocompromisation, right? Not being vaccinated, lack of child care, so having to send your child to school even if they're sick, right? Not being vaccinated, not disinfecting enough, vaping, not covering your mouth, close quarters, exposure, great. And then the second question here, what are some things that people can do to reduce the chances that they're going to get the flu? What are some protective factors we could be trying to build up here? Wash your hands, wash your hands, wash your hands, wash your hands. Get vaccinated, vitamins, masks, shots. Yep. It's so funny. There's not a lot, everybody has the same answers here. It makes it feel like maybe there's a simple way to protect ourselves in some ways, right? Eating healthy, disinfecting, staying home when you're sick. Yeah, exactly. Perfect. So because we take this public health approach, not just to the flu, but to substance use, Using epidemiology helps us to understand how substance use shows up in communities or groups and how people get it and what they can do to protect themselves. These are the same kinds of questions we're going to ask, or these are the kinds of questions we're going to ask in order to assess and understand the nature of substance use problems and their related behaviors. We gather data on substance use and its associated problems to help us understand it. And the data that we gather are going to answer these questions. What are the problems and related behaviors that are occurring in this community? What are those consumption patterns? What are the consequences that people are experiencing? We want to understand that. We want to understand how often those things are occurring. So, is it happening at particular times of the year, particular seasons, particular frequency? Where is it occurring? Are there places in our community where specific problems are happening more often? Are we seeing different things in certain neighborhoods, at schools, at the workplace, particular physical locations like parks or the woods? And then which groups are experiencing them more? Is this a youth thing? If it's a youth thing, is it a sixth grade thing or an 11th grade thing? Is it impacting people based on whether they live in more rural areas or more urban areas, right? So trying to just understand a little bit better what's going on. So to answer these questions, we need to gather data that helps us to understand the substance use problems in our specific community. Nicole, I'm sending it back to you.
All right. Thank you, Katie. So now we are here at sort of our case study portion. And so we have developed just an example that you all can use in your communities to work with your coalitions or other things. And Richard's going to post that in the chat for you. And it also was posted in the chat earlier. There we go. Thank you, Richard. And so I'm going to just quickly summarize this because this is a lunch and learn today, but I encourage you to look at that and work with your communities as you work through that issue. It's a really great tool to help with learning and mentoring other coalition members. So let me just give you a little rundown of our case study. So Riverton, in this case, is a mid-sized community of about 45,000 people. Over the past 3 years, schools and parents have raised concerns about increasing vaping and e-cigarette use among both middle and high school students. The community coalition, Riverton Youth Strong, has decided to conduct a needs assessment to guide prevention planning, and you are going to be working with the data subcommittee of this coalition to lead the needs assessment. So we're going to kind of walk through some of these steps that you would take. We have some data, which of course is what we're focused on today. And so just walk with me through this activity and we'll see what we can do with this data. So let's talk about our assessment steps in Riverton. We are going to have our nature and extent of substance use and related behavioral health problems, like we talked about. And that's what we're going to look at first. So let's take a look at our data. We've got a youth survey, we have school disciplinary records, community perception survey. We did some focus groups, which is qualitative data, right? And then we have our local health department records and retailer compliance checks. So the important things, we've got our indicators over there, but we really are going to focus in on those findings over there to help us move through our assessment. So on our youth survey, we found that 24% of 10th graders were reporting vaping, and that was up from 14% in 2021. We also increased our vaping related incidents by 65% in the last 2 years, and that's from our school disciplinary records. We also have 48% of adults who believe vaping is harmful for youth. And when we talked to the students in the focus groups, they said that people are vaping related to stress, and they believe that everyone does it and it's not as bad as smoking. And then from our local health department, we see that we've had an uptick of 30% of youth seen for nicotine related health issues there at the health department. And we also have seen that our retailers are not completely compliant. We have 22% who have a non-compliance rate. And so that indicates that there's being sales done to minors. So, taking all of that into account, we're going to do a poll here. What data points do you think help us determine the substance use issue and related behaviors of concern based on what you're seeing? We'll give you a minute to do that. Great, see some coming in. See a few more of you respond. You're taking this data in really quickly, so you're doing a great job. All right, I think we'll go ahead and close the poll, Richard, and we'll share those results. So we had a majority of you, which is awesome. You said all of the above, right? We've got 24% of 10th graders reporting vaping in the past 30 days, which points to our issue, our problem. We have the number of vaping related school disciplinary incidents. Great. And we have nicotine related health issues are up. So all of those are pointing to that critical issue of the behavior and its consequences that help us determine we're going to address vaping. So let's go ahead and stop sharing that. And let's go back to our data and talk about our next assessment stop. So we're going to move on to the logic model. So here we are. We've got our logic model. And how did we arrive at our problem? Well, we looked at the data, right? So we now know that high school students are vaping nicotine at high rates. They're experiencing health consequences, and there's some related disciplinary problems. Perfect. And you all did a fabulous job of that. So let's move on to our next assessment step, and that is the risk and protective factors. So now we want to know we've assessed what the problem is and its consequences. Now we need to know, why is this happening? What's the context behind this in my community? So that's what we're going to do next. So we're back to our data. Why are we seeing the problem-related behaviors? What data is going to help us? So what risk and protective factors do we see? Once the priority problem is identified, we need to assess the risk and protective factors that influence the problem locally in Riverton. What's contributing to a problem in one community might be very different than what's contributing to it in another community. So Riverton might look a lot different than my small community here in Norman in Oklahoma, right? And so I've got the influence of a university here and some other factors that make Norman a little different. And so we always want to look at what's going on in our local community. So our poll is going to come up. And now let's ask you, what risk and protective factors do you see based on the data here? And see what you have to say. All right. Seeing some things come in. And yes, Julie, thanks for your comment. You're correct. Less than half of the adults feel youth vaping is harmful. That was a little bit of help for you answering the poll. And Irina says, youth being seen for nicotine related health issues. Great. All right. Well, we have about more than half of you have responded. So we're going to go ahead and end the poll, Richard. And we do have some of you, 65% saying all of the above. But when we look at this, vaping is inexpensive. That one we know is not true, right? Vaping can be very expensive at about, it varies where you're at, but at least $25 per vape. So that can be pretty expensive for a youth. And then high parental perception of harm. We don't really have high parental perception of harm, do we? Because if we look at this data, it says 48% of adults believe vaping is harmful, which leaves 52% that don't. Okay. And those parents are going to be very big influences on youth and how they think about this. So we don't really have that either. But what we do have is retail access as a risk factor because we have that 22% non-compliance, which means almost a quarter of vape retailers, let's say, are doing sales to minors. And when you have that kind of access available, that can really cause you to have a large substance use issue. It'd be like with drinking, liquor stores are not IDing folks, right? And selling to minors. And so this is a really big issue that we need to address. Well, you all did fantastic. And it's just an example of how you really have to dig deep in that data to find out what's really going on. If we were in another community, it might look a lot different as to the reasons people are vaping. All right, we will close that poll. And let's go back to our logic model now. And how did we arrive at our risk and protective factors? Again, the data. So you'll hear me say that a lot. We're going back to the data. So adults who believe vaping is harmful for youth was at 48%. So we've got a low perception of harm from the parents. You say it is not as bad for you as smoking. So we're bringing in that qualitative data as well. And so there's also appears to be a low perception of harm among youth. And then if we look at retail access, which we just talked about in our poll, we have relatively high vape shop noncompliance rates, right? So for you, what types of data did we use to come to this conclusion? And I did give you a little clue. Quantitative or qualitative?
Well,
Both. Yay! Awesome. You guys are great. We used both. We brought in that focus group data. And this is really important to really add some, what I call like the nice color to the numbers, right? It kind of paints a picture that we didn't have from just the surveys. So let's go back now to our data and talk about the final assessment step. You're almost there.
before we do, Nicole, I just wanted to highlight someone in the chat had asked, I'd like to know the retail density and the N number in the checks. And I think those are some really great questions that emphasize emphasize that you may want to dig in a little bit deeper and try to sort of find the source information for some of this data to be able to ask those questions.
Great point. Thanks for bringing that up in the chat. And yes, these are not the only things you can look at. Honestly, when you're doing assessment, you may, as you're going through these steps, you're going to find things that make you want to know more about something. And so it's going to trigger that response to go dig even deeper. And and then you're going to have a more effective spiff process in the end again. So very good point. All right, so now we are at our final step. We are now at the process of looking at our existing resources and readiness of the community to address its problems. And so we're going to then look at some things that can affect what we decide to do. And we will get into this in much more detail later with the lovely Wanda Hudson, who's going to be doing capacity and planning. But I just want to touch on this a little bit so that you know what's coming. Well, let's talk about selecting risk and protective factors. So just like our communities come up with the 4 criteria for selecting priority problems, communities have also identified 2 super useful criteria when we try to select which risk and protective factors we want to focus on. So importance is going to look at how much a risk or protective factor is impacting the problem. So we know we have this risk factor of compliance rates, right? So retail access, and maybe we want to look at how much is that impacting the problem a little more. We could do that with some other data sources, things like that. We also want to look at changeability. So is the community ready? Do they have the capacity, the resources and readiness to address this particular risk or protective factor? So maybe when we get in that situation with our retailers and we are trying to do something about the retail access, we don't have a lot of support from them. So even though that's going to be really important to change, we might not be able to make as much of a dent in that. So those are things to look at and consider. And this really gets into the practicality of what you're going to do in your community. So in the chat, what do you think the coalition should be looking at in Riverton in terms of resources and readiness to address youth vaping? What would you do as a coalition member working with youth? Jerry says qualitative can also give us resource connections. Yes, definitely. We might need to look deeper with qualitative data to really look at, how important is this risk and protective factor and how changeable is it going to be? Do we need to go back to those retailers and do some key informant interviews or do some focus groups to determine, is this going to really work in our community? Great. Community readiness interviews. Perfect. I love it. And work on getting the compliance number higher for retailers. Yeah. And I like what Chelsea has to say too here. There existing coalitions or networks that could be involved in these efforts. So maybe there's other partners we need to look at. How can we bring them in? Parent groups, the Chamber of Commerce. Very good. And also, yeah, can continue to do some more needs assessment activities. We could do more forums. We could look at a survey. All of those are great answers. All right. Well, thank you all. We're going to get back to that logic model now and go look and see what we have so far. So, exciting times when it comes to people who love logic models, but here we are. This is one example of what a logic model might look like after the assessment has been done. And you all have just walked through that process so beautifully and quick. And we've identified nicotine vaping among our high school youth as a problem. And we've got different risk factors here listed. So we've got high level of retail access. We have youth low perception of harm. But let's say we also found that we had a protective factor. And after doing more focus groups, using more qualitative methods, we found that we really had some good school engagement that was a protective factor for vaping. And so that might be something we also would want to look at and figure out how we could bring that into looking at what we want to do based on the data. So we have another poll. So assuming both risk factors are of equal importance, which risk factor do you think might be more changeable? And this is really, an opinion, but we just want to see what you have to say. No right or wrong here. Okay. We've got about half of you responding. So, Richard, I think we're going to go ahead and close the poll. And we ended up with low perception of harm coming out associated with the nicotine vaping. Great. And I'm sure a lot of you are concerned, having worked in the communities, about what's the changeability of retail access in this community. Because I know you know how hard it is to get some of those folks on board. It might be easier to get the youth and the parents on board once they know the risks, and that may be something that actually is more changeable than getting retailers who have a commercial interest on board. So thank you. And then I see some comments in the chat here. Deanne, I would want to know the youth's response of where they get their vape products. Just because there is a high number of retailers out of compliance doesn't mean that is how youth are accessing. Great point. Great point. Thank you for that. Very great. All right, we're going to close this poll and we will now turn it over to Katie to talk about a tool that's available for you.
Thank you. So this I think is probably especially for folks who are a little bit more familiar with the SPIF. Maybe you've been introduced to assessment and logic models prior than today. We do have what I think is a really useful tool. I'm biased because I made it, but I think it's helpful for really thinking through how do we loop this data into each step of the logic model and exactly the way that Nicole has walked us through this. So Richard just put the link to this in the chat. You can take a look at it at some other time or now, or download it and put it on your computer and come to it whenever you want. Once you go to that link, you'll see that you have to actually click on the resource for the Excel tool to download it. So this is in Excel, and basically there's three main tabs. One's for assessment, one has the complete logic model, and one is for evaluation. You can use each tab to kind of track your data indicators and the sources. So under assessment, you would track both the problem and then the risk and protective factors that you're identifying as most important in your community. And by keeping track of the data indicators and the sources, you can regularly recheck those indicators as data updates to ensure that those are still the most urgent behaviors and factors to address in your prevention work. In that online PTTC resource, you plug in the risk protective factor, the indicator, and its source. You keep that for yourself and come back to it as you're doing your assessment, maybe next year or maybe at the start of a new grant cycle. And if that's something you're interested in, let us know, because we will have some more resources on that and can also provide individual TA on that to help support your work. All right, so we are nearing the end of our time together. Some key takeaways. So we're hoping that at the end of this hour, you're really taking away that assessment is the foundation of the strategic prevention framework. That data-driven decisions prevent this process of just throwing programs at problems. That using multiple data sources can help create or help give you a more complete picture. That you will apply criteria for selecting the problems, right? It's not just, oh, I actually have a history in working with folks who underage drinking problem, so that's the problem I'm going to target, but rather that you're pulling that problem directly from the data about your community. Similarly, that you're applying criteria to select the relevant risk and protective factors. And then building a logic model can help connect the problems, the factors, and the interventions. And then finally, each priority problem really should get its own logic model so that you're able to really address each piece in a way that is most relevant and therefore likely to have the best outcome for your community. Let's pause for just a minute or two and love to hear any questions that you all have. Oh, and Emily, I see your comment about the questionnaires with students. And yeah, that
Hmm.
is it is a common challenge. I think it's becoming more frequently challenging. To me, that's one of the places where our focus groups could be really great because if you can't get representative data from everybody, but you do have access to a group of students who can give you some of that insight to maybe complement other available data sources, that might help address the gap that you're seeing. Might explore both in an outside setting, the same kids. Mhm.
Hmm.
Great. Is
And
there,
if you all are having trouble with surveys or need other examples of data sources, feel free to email us. We also do individualized technical assistance if you are working in our region. So,
I'm also seeing questions about resources for focus groups, questions, etc. Um, Again, I definitely reach out for that, but um, I will try in the next couple of minutes. The SPTAC, the Strategic Prevention my brain is my words
Strategic
cannot speak.
Prevention Technical Assistance
Assistance
Center.
Center. Thank you, Nicole. Did a whole series on focus groups and listening sessions last year. So we can provide you, point you in the direction of that information, and also, of course, provide more specific coaching on it. Yes, Deanne, that's the last one I'll respond to before moving to the next slide. Um, some surveys do require IRB approval, which can be challenging and time consuming. If your state already runs a survey, you might be able to use their data instead of creating your own. You may be able to add a question or two. Some surveys don't need IRB approval. It really depends on the specifics. So don't let that be a barrier to getting any data. Just know that it might take some effort to figure out.
Yeah.
Nicole, do you want to talk about the evaluation real quick?
Sure. Thanks, Katie. And Richard has posted the link in the chat there, and you can also scan this with your phone to take our evaluation survey. So we just talked about how data is so important, and we encourage you to provide your feedback for this session. This is one of five this week, and so it just helps us take a look at what you're thinking and what you'd like to see. And also how we did. So please fill that out for us. We really appreciate the feedback. And then we finally, like I said, we are having a sprint this week, or some of us called it a blitz. So every day this week, we are doing a Step of the Spiff webinar right before the holiday to get you all excited about the spiff. So tomorrow we will be doing capacity, and you can register for the rest of our sessions this week with that QR code. Again, you can just scan that with your phone and you can get registered for our next events. So we will also be making sure you get all of the resources from this series. Usually it gives us about a week to get everything squared away and get that out to you, but you will receive all of our materials and recordings from this webinar series. So we will get those out to you in about a week.
We do have another slide with our email addresses on it, but I want to keep this up so you can use the QR code if you want.
Yeah.
I'm just dropping Nicole and my emails into the chat, so feel free.
Perfect. Thank you, Katie. And like I said, Katie and I both do individualized technical assistance on data. And so we would love to be able to help you out in a more customized way if you work within our region. Our region includes Oklahoma, Texas, Louisiana, Arkansas, and New Mexico. So if you live in one of those 5 states, we are more than happy to help you if you've got some individualized things that you need related to data. And let's see here. Will a certificate of attendance be available? Yes. When you get those materials, there will be a link for you to get a certificate for today's webinar. And Jerry, thank you. Yeah, Spiffy Day. That's right. It is a Spiffy Day. And I do see a question about the East Coast. If you are outside of our region, you are always welcome to attend our webinars. But if you need individualized technical assistance, we will get you in touch with your respective region for that assistance. So thank you so much, Boomer Sooner. Awesome. Yeah, I am here in Norman, so I appreciate that. Seeing if there's any other questions, but you all have been awesome. And we do also have a resources slide as well. If we want to move to that, Katie, real quick. And these will all be available for you as well when the materials come out. But those are some deeper dive resources that will be available for you also on our website.